Hello, I am Superintendent Barbara Jenkins, and today we are providing answers to some questions we've received regarding the COVID-19 vaccine and the recent approval for 5 to 11-year-olds. I would like to introduce our guests. Dr. Vincent Hsu, Executive Director and Epidemiologist for Infection Prevention at Advent Health. He is also the chair of the school board's Medical Advisory Committee. And Dr. Raul Pino, Director of the Florida Department of Health in Orange County. Both have been dealing with the global pandemic here in Orange County, so I want to thank them for their tireless commitment. We want to get right to your questions to provide you with answers from the experts and encourage parents and guardians to work with their healthcare providers to make decisions for their children. Our first question, Dr. Hsu. We have a question from Dorabelle, who is a parent at Bay Lake Elementary School. Do kids 5 to 11 years old require 2 doses like adults, and what are the side effects?
Yes, children do need 2 doses just like the adult population. But it is important to note that these doses are a third of the adult dose. So they do require different vials. They are spaced 21 days apart, just like they are for adults. As far as side effects are concerned, there are some side effects that are noted. They are very similar to what we have seen in adults. Most of them are very, very mild. They include things like tenderness at the site injection area, some fevers that may last for a day or 2, muscle aches, but generally these are very mild and very well tolerated.
Thank you. All right, Dr. Pino, Letitia, who's a parent at Independence Elementary School, said, what are the numbers of children in the 5 to 11 age group infected with COVID-19 so far in the U.S.? And of these, how many died, and what are the risks of the vaccine for this age group?
So in the United States, up to yesterday, about a little bit over 2 million kids in this age group, 5 to 11, had COVID-19 that we know. Of course, there has been many kids who has been asymptomatic that otherwise were not recorded. So I want to give that caveat to people that although these are the official numbers, it could be a little bit higher than that. And with regard to how many kids in that age group have died, about 173 in the United States. Now, keep in mind that our population on that age group in Orange County is about 124,836 kids. So we have some work to do in this area.
Very good. I'm always impressed when you keep all those numbers in your head like that, Dr. Pino. All right, the next question is actually for me. It is from Lisney, who's a parent at Arbor Ridge K-8 school. Will it be optional to vaccinate for school? And the answer to that is absolutely. It is optional for parents and families to determine whether or not their child will be vaccinated. At this point, the state of Florida has no other provision in place. It is optional. Back to Dr. Hsu. Doreen, who is a parent at Keenes Crossing Elementary School, says, my child will turn 12 on December 18th. Is it better or safer for him to get the 5 to 11 age dose or wait until he turns 12 on December 18th?
Yeah, that's a tough one because December 18th is just right around the corner. In general, what we would recommend is that the further it is until the child turns 12, it's going to be next year, we would just encourage that you go ahead and get the 5 to 11 dose, which is a third of the dose for children, because we believe that the benefits of protection really are great if you get it immediately, and we don't want you to wait and have that additional risk. We also recognize that there are some 10, 11-year-olds who are almost adult size, but the trials that have been done with this lower dose has demonstrated that the immunogenicity or the antibody titers are really good and effective. So generally speaking, we would recommend that you go ahead and get your 5 to 11 dose as soon as possible.
Very good. All right, Dr. Pino, Christine, who's a parent at Odyssey Middle School, says, how is this safe if there have been cases of kids having heart issues and other issues because of the vaccine?
So that's an interesting question in the sense that, we have got a lot of questions about side effects. And part of what we want people to realize is that we are going to see an expansion with the expansion of the vaccines that we have done, meaning we have vaccinated millions of people in a very short period of time. So normally you will see all the side effects that you can see possibly when you are vaccinating such a large number of people. The reality is, during the clinical trials for children, there were not major health issues or risk presented to kids. As the doctor said before, it was very minor and mild, some of the side effects. But for those who have specific concerns, because a child may have a heart condition, or the child may have asthma or any other disease, consult your provider. Always talk to your doctor before making that decision. And at the end, it's your decision. And you have to outweigh risk.
Very good. Always talk to your doctor. All right. The next one is for me. So Jeff, who's a parent at Vista Point Elementary School, said when adults are given the shot, most feel sick afterwards, or their employer provides a few days off. Will the school consider excused days off after a child receives his or her vaccination? And the answer to that is yes, absolutely. Anytime a child is not feeling well, we want the parent to keep the child at home, and it is considered an excused absence. Let's make sure we don't have any students taking advantage of that, though. All right, back to Dr. Hsu. Marco, who is a parent or guardian at Hunters Creek Elementary, said these shots are still under clinical trials. Can't this wait until the trials are over in 2023 when we can have full data on what the long-term effects are?
Well, we feel at this time, and we want to make it very clear, that the trials were being done in accordance with FDA guidelines. There were no shortcuts taken, so I don't want anyone to think that these were abbreviated trials or they were somewhat incomplete. They were not. And so at this point, the FDA has deemed that these vaccines were safe and effective at the time of authorization. Now, of course, we are continuing to learn more about these vaccines, and we are continuing these studies a little further. We want to know what's going on as we get more children vaccinated. But right now, we feel absolutely confident in the trial results at this point. And so it's safe to proceed at this point.
Very good. Dr. Pino, Mercedes, who's a parent guardian at Laureate Park Elementary, says, how can I get an appointment for the vaccine for my two kids?
So you have these parents that are so eager to get the kids vaccinated. So there are several ways. So remember your provider. That's the first line of defense. If you have a provider and your provider have ordered the vaccines, that could be a place where you can make your appointment. There is also the pharmacies, the CVS, the Walgreens are going to have it. And of course, the health department is going to have it as well. In our case, they can call our line, which is 407-858-1400. That's our switchboard. And there they will guide in how to make an appointment. Now, what is also important for people to realize is keep in mind who is your child and where your child would do better on the vaccination. And I explained yesterday in the press conference that some kids are not set to be in a drive-through location or in type of open environment because they are afraid of the vaccine. They may need to be hold and restrain a little bit. And the drive-through presents some additional risk. Traffic, vehicles, the vaccine is through a window. So keep in mind who's your child, how do you think your child is going to behave, and also have a conversation with your child about the vaccine, what is important to get it, what they are going to feel, what could be the side effect, and why we are doing this.
Very good. Another question for me. Will my child's current religious exemption cover the COVID-19 vaccine? That's an interesting question. So we do have religious exemptions provided statutorily for all of our common immunizations, MMR, measles, chickenpox, what have you.
This vaccine is not mandated, so it doesn't need an exception.
You beat me to it. You beat me to it. So it is not a required vaccine, unlike some of the other vaccines that are in our requirements for school attendance. So you don't need any kind of exemption, religious or otherwise. If the state at some time did make it a mandatory vaccine, then we believe the religious exemptions would kick in, but that is not even an issue of concern at this point. Back to Dr. Shu. Amanda, who's a parent at Windermere Elementary, said, my child recently got the flu shot. How long should she wait to get the COVID-19 vaccine?
You know, there's really good news for this. You don't really have to wait at all. In fact, you can get the COVID vaccine alongside the flu vaccine. There have been studies now that have been done that demonstrated that when you get both vaccines at the same time, the antibody effects in the immune system really reacts the same as if you were giving them individually. So it makes it a lot more convenient for those of you who haven't gotten your flu shot. If you need to get the COVID vaccine for your child and you want to do that, you can also get the flu vaccine at the same time.
That's important, as flu season is upon us, and we are hearing from other districts that they're seeing increased flu incidents, so that's very good news. Thank you. Dr. Pino Kanglu, who's a parent at Bay Meadows Elementary, said, if my daughter had COVID-19 before, should she still get the vaccine?
The short answer is yes. Now, the question is always how long does she has to wait? And again, consult your provider. I don't know the case of that child, but the answer to that is yes. The immunity that is acquired through natural immunity tend to wane out after some period. And that's happening also with the vaccine, with the 2 first doses. That's why a booster is required. So, you know, right after having COVID-19, someone will have immunity. It can be measured. Some people don't respond the same way that others. But in general practice, yes, they should be vaccinated.
Still need to be vaccinated. All right, Dr. Shu, James, who's a parent guardian at Vista Point Elementary, asked this question. If children are at the lowest risk of health complications due to COVID-19, why are we being asked to inject them with a vaccine that needs more research?
It is true that, generally speaking, children do not suffer the severe disease that adults do. But yet we also know that children can spread the disease. And as Dr. Pino had said earlier, there have been serious hospitalizations that have occurred and deaths that have occurred. Everything that we do is a matter of risk and benefits. And so certainly by not getting the vaccine, your child could be put at greater risk. Even though that risk may not be as high as adults, there still could be a risk. So waiting or delaying or not choosing to immunize your child does convey certain risks. In contrast, we believe that the benefits of vaccination really outweigh the risk at this time.
Very good. All right, Dr. Pino, Daniel, who's a parent at Lake Nona Middle, said, is the vaccine safe for children with asthma?
You know, that's interesting because we are going to have many asthmatic children that in our district. Not every single asthma was created equally. In the sense that people respond to have different triggers. Mm-hmm. If a child is asthmatic, I'm pretty sure they have a care plan, they have a provider. Consult your provider, verify what the triggers of your asthma are with your provider. Also, let the provider know and ask about the ingredients on the vaccines. Now, in the clinical trial, there have not been major side effects to the vaccines, but as I said before, as we expand these trials, as we go larger into the community, we are going to see a number of side effects that may not have been seen as frequent in the clinical trials. So it's important to talk to the provider. It's important to know what are the triggers for your child, and it's also important to know if you have an allergist, to talk to your allergist about the components of the vaccine and if your child is allergic to any of the components.
Very good. All right, Jenny asked this question for Dr. Shu from Village Park Elementary. Where can I get more information about the vaccine in children, the side effects and results of the test carried out, etc.? Is it safe?
Yeah, we want everyone to be as informed consumer as possible, and we want to make sure that you get the right source of information. Generally speaking, I recommend the CDC website, cdc.gov, and there's a link right to COVID and all the information that you need to know. If you would like to talk to someone, first of all, of course, talk to your doctor. who is knowledgeable in these issues. The health department is also a very good source of information, and as Dr. Pino had said, there was a health department number 407-858-1400 that you can call if you want any information or you want to be able to talk to someone about that, as well as the Orange County Department of Health's website.
So glad you mentioned that, because everyone is trying to research and there's so much misinformation on the internet, so those are good sources for parents to be aware of. Thank you. All right, Dr. Pino, I will answer a part of this one as well, but Karen from Castleview Elementary wants to know, will they be able to give the vaccine to my child at school? And will they receive a vaccine card as well? So let me answer the first part. If you go on our website, ocps.net, you can certainly see all the COVID-19 information, including the vaccine clinics. We coordinate closely with the Department of Health, and all of that information is provided at ocps.net. If you look on the tile that says COVID-19 information. Each of our high schools will be hosting a clinic so you can get your shots somewhere close to your home. Dr. Pino, how about that card?
Well, before I answer the call on the car, also I tell you that I was pleasantly surprised when I was going to move into doing the schedule was already done for the vaccines. So that was a plus. So yes, they will get a card, of course. The records will be permanently with the health department. If they lose the card, they can always replace it. Also, we advise people, if the cards have thermal paper in the printer, not to laminate the cards, because the heat will destroy the information. But if the information resides with us, we can always pull it out and provide you with an additional card.
That's an important note. Gentlemen, thank you for your time. I want to give you an opportunity to make a final comment before we close out here. Dr. Hsu?
Thank you. We recognize that it's really, this pandemic has really been tough for all of us. And it's been, even though it's been almost 2 years, a lot of activity has really moved forward. And vaccine development has occurred very quickly. We recognize that it's a decision that you have to make for your child, and we want you to be informed as much as possible about the safety, the benefits, the risks. Overall, I do believe, from what we've seen, that the science indicates that it is safe and effective. But do your research, talk to your doctor, get as much information as you can to make that decision for your child.
Thank you, Dr. Hsu. Dr. Pino?
Thank you for inviting me. I think on Dr. Hsu's point is we don't want to force you to get the vaccine that you don't want. We are going to make it available to you. We think and we suggest that you vaccinate your child, always in consultation with your provider. And if you are going to look for information, look in the right sources, get informed. Go to the CDC website, it's plenty of information to digest that right there. And also the makers of the vaccine has a lot of information on their website, on this case Pfizer. Find that information, read it, make a decision. But this is about prevention. And what I want to alert people is, not because we are at this great point that we are today, doesn't mean that we cannot go back. And part of getting vaccinated and getting our children vaccinated is to increase the chances that we will never go back to where we were.
Important point. Thank you, Dr. Pino. Dr. Hsu, we have provided a lot of information and resources on our website, ocps.net. If you're looking for more information, look there as well. If we didn't answer your question, you will also find a list of additional frequently asked questions about COVID-19 and vaccinations, along with the dates and times when a vaccination event will be at a school near you. Please use these resources along with advisement of your healthcare provider. Thank you for watching. Let's all stay healthy.